Every time your pet exhales, they release thousands of tiny, invisible molecules. This breath acts as a silent broadcast of their internal health. These molecules are called volatile organic compounds, or VOCs. They are created as your pet's body processes food, filters waste, and produces energy. When an organ struggles, this chemical cycle deviates, altering compounds released out through the lungs. Because these chemical shifts occur at the cellular level, they often manifest in the breath weeks before a pet shows visible behavioral changes. This makes the breath a highly proactive detection system for issues still hidden beneath the surface. By following a simple step-by-step system, you can learn to decode these specific odors and know exactly when it is time to seek a professional veterinary evaluation. To start, gather a notebook or open a digital app to create a health log. For an accurate reading, your pet should be calm and away from recent meals or treats. Step 1 is establishing a baseline. Get close to your pet and take a brief, non-invasive sniff of their breath while they are relaxed. This baseline is a mandatory prerequisite. Identifying a future medical anomaly is only possible if you have already recorded the standard, healthy state of your pet's unique chemistry. Focus on departures from the norm. A meaningful health indicator is marked by a sudden, persistent shift away from the specific scent profile you've just established. Logging this baseline provides a consistent reference point, replacing subjective guesswork with a clear standard for future health audits. Step 2. The weekly sniff test screens 3 categories: digestive. Mild sourness, vinegar, or rotten eggs point to stomach or intestinal issues. Metabolic. Musty, ammonia, or sweet odors signal liver or kidney dysfunction. Oral. Metallic, fishy, or decaying odors indicate periodontal disease. Rule out temporary influences like a recent meal or a new chew toy. To actually indicate an underlying health issue, the unusual odor must be persistent and recur over several days. Recognizing an abnormal odor is the first step of the process. To understand what is actually happening, you must integrate olfactory findings with specific behavioral observations. This brings us to step 3, the symptom cross-check. You perform this step immediately after recording a persistent, abnormal odor in your log. If you detect a digestive smell, look for frequent lip licking, repetitive swallowing, burping, or suddenly eating grass. For metabolic smells, check your pet's daily habits. Note if they are drinking excessive amounts of water, urinating more frequently, or showing a sudden drop in energy. If you notice an oral smell, inspect the mouth. Check for pale or bleeding gums, look for heavy drooling, or difficulty chewing their food. Consider the governing rule of this audit. Breath odor alone is a whisper of a problem. But breath odor paired with a distinct physical behavioral change is a loud shout demanding immediate veterinary attention. Next, step 4 is the action plan. Using the data gathered in your log, you can now determine the appropriate medical response. This flowchart guides your decision. Mild odors with no physical symptoms trigger the yellow light scenario. Monitor closely for 48 hours. However, persistent metabolic smells like ammonia or any odor paired with symptoms like vomiting trigger the red light scenario, requiring immediate veterinary action. Do not rely on at-home breath gadgets to make medical decisions, and avoid using human toothpaste to mask a concerning scent. The purpose of this audit is not for you to provide a diagnosis. The goal is to trigger professional diagnostics, such as blood work or imaging, at the most effective time. Step 5 is establishing daily prevention habits. Consistent dental care, a balanced diet, and fresh water are the foundations of healthy baseline breath. You now have a complete system. Establish a baseline, categorize strange odors, and cross-reference them with symptoms to determine the next steps. By using this system, you can catch internal organ strain or dental infections before they progress into severe pain or a medical crisis. So when this video ends, take a quiet moment to sit down with your pet and log their baseline breath. Dedicating just 10 seconds a week to this simple audit allows you to become your pet's most effective first line of defense.